sort of patients I'll see with alcohol-related liver disease fall into two categories. If I was to take you along the corridor to our ward, you would find lots of patients in there with advanced liver disease. These are patients who might be bright yellow with severe jaundice, who feel terrible. They might be patients with severe fluid retention, so they have terribly distended bellies with lots of fluid and they're very uncomfortable. They might be patients who are confused, anything varying from mild confusion to being in a coma. And then perhaps the most extreme example of patients who get severe internal hemorrhage, where they will vomit blood and become severely unwell from that. And so these are all very unpleasant ways for liver disease to manifest itself. Sadly, that's often the first clue you have, because liver disease is, the liver itself is very effective at soaking up punishment, and so the liver has to be very badly damaged before the disease comes to light. So the second type of person I may see is somebody who has abnormal liver tests detected before they have symptoms for some other reason. So I often see patients in the clinic who seem completely well, but actually there is liver damage happening underneath the surface. And of course that's the sort of person who you can perhaps intervene and help. The patients who are in the ward with these advanced complications, they have irreversible damage, and it's very hard to turn the clock back from there. You'll hear a lot in the press about we're seeing younger patients and more women than we used to do, and that's certainly true. It's important not to get the wrong end of the stick there. The vast majority of people that we see are still men, usually in their middle age or beyond, sort of 50s or so, 40s and 50s. But we do also see young women as well, and it is a tragedy to see somebody, in their early 30s or even younger who already has cirrhosis of the liver, irreversible damage. These patients may well have what's called alcoholic hepatitis, where they have severe, sudden, acute injury to their liver, which is often fatal. So middle-aged men form the bulk, but still women as well, and young women too. In terms of the social distribution, we see people from all classes of life, people from all strata of society. But nevertheless, the people who are hit hardest for sure are the people in the most socially deprived areas. The sort of drinking pattern that we see in our patients who have alcohol-related liver disease is variable. I think it's important that people understand that it's the total volume of alcohol taken. It doesn't matter what type of alcohol, it doesn't matter whether it's spirits or beer or wine, it doesn't really matter whether it's taken in a binge or slowly over time. It's the total volume which does the damage. The strength of wine and beer that people drink has increased over the last few decades, and so the old rules about units are an underestimate. People used to say, 1 unit was half a pint of beer, 1 glass of wine, 1 measure of spirits, and a bottle of wine might be 6 units. Now, in fact, a bottle of wine is more likely to be 9 or 10 units than 6 units, and a large glass of wine can be 2.5 units of alcohol in itself. So the person who's having what they think is quite a safe limit of a couple of glasses of wine every night may in fact be doing themselves liver damage. And it's that insidious damage which is probably more dangerous because it's so hidden, as compared to somebody who is binge drinking. It's kind of obvious. Somebody who's going out on a bender on a Friday and Saturday night, they're doing themselves a lot of alcohol damage. And of course, the damage there can be more immediate in terms of trauma and harm. Certain other medical conditions are more related to binge drinking, for example, pancreatitis. But liver disease in general, perhaps with the exception of alcoholic hepatitis, which is perhaps, as I mentioned earlier, an acute injury over a few weeks. But most patients I see who have liver damage with cirrhosis, they will have been drinking in excess of what's safe for many years, usually decades, often without realizing it. I can't emphasize enough the fact that there's this long lead-in period of a apparent good health when the damage is occurring. I think many patients read in the newspapers or in the media about these safe limits. They know they're drinking more than that, but they kind of assume that they're one of the lucky ones who are okay because they feel okay. little knowing that there's damage happening underneath the surface. I suppose most patients I see with cirrhosis, i.e. have been drinking alcohol to excess over many decades, will have a degree of dependence. But it is surprising. Some patients, they find out they've got liver disease, you say, you're damaging your liver, you have to stop, and they stop, no problem at all. But they're probably in the minority. Many patients, I sometimes think of it as their heart ruling their head. I mean, these people want to stop, they're not kind of trying to be difficult. But alcohol is an addictive drug and a destructive drug. And the alcohol dependency ruins not just their own lives, but all the lives of people around about them. Often many of the patients we see, there's a tragic cycle of, first of all, they lose their job, then they lose their marriage, then they lose their health. Patterns of drinking have changed a lot over the years. Nowadays, most alcohol is not consumed in pubs or in public places. It's consumed in the home, or tragically sometimes in public spaces, such as down in the park. And particularly heavy drinkers become very sensitive to the price of the alcohol. They will, if you like, step down so that they're spending the same amount of money but getting more alcohol for their money. And there's been rightly a lot of publicity over the last decade or two about very cheap alcohols, particularly very cheap cider, very cheap vodka, and the damage that that alcohol can do for very low spend is scary. The heavier drinkers, particularly dependent drinkers, rely on and concentrate on the cheaper alcohols. It makes common sense that they do that. So what do I think about the legislation, which of course is enacted, but it's an act of Parliament, but has not yet been introduced because of challenges from the drinks industry. Do I think the minimum unit pricing, as it's become known, would be effective? I mean, I feel very passionately about this because I'd like to think that as a doctor I can approach the evidence impartially, and the evidence is overwhelming that in every culture, at every time point, there is a very strong link between alcohol consumption and alcohol-related deaths, and between alcohol consumption and the availability of alcohol. And the availability of alcohol is a balancing act between one's disposable income and the price of alcohol. So price is an absolutely crucial determinant of deaths from alcohol-related liver disease, or deaths related to alcohol in general. The two ways that you can influence price are by taxation, or by this novel idea of setting a threshold below which alcohol should not be sold. Here in Scotland, we don't have powers to influence tax, but even when tax has been used, it is effective, but it's a blunt tool because it affects everybody. Minimum unit pricing very selectively targets the heaviest drinkers because they're the ones who are drinking the very cheap alcohol. You couldn't invent a better public health policy. We've spoken so far about alcohol-related liver disease in terms of deaths, but of course there are many other ways in which alcohol can kill you, from trauma, suicide, cancer. It's linked to many cancers, including breast cancer. I think there's good evidence there. And if you add up all the deaths that alcohol is causing in these different ways, it's in excess of 20 deaths per week in Scotland. So 2 football teams or a football match every week are dying because of alcohol. And I think that we've got to think of alcohol as a drug. I'm not necessarily saying alcohol is all bad. I think that if there was no alcohol at all, would the world be a better place or worse place? That's a debate to have. But alcohol is not the same as buying your food and drink in the supermarket. This is a drug, and we have to approach it as such and regulate it as such. I hope it's become clear that although I'm spending my professional life looking after people who have advanced liver disease, the solution to alcohol-related liver damage doesn't lie in the hands of doctors like me. This is a public health issue, and prevention rather than cure is what we need. if I, as a doctor, could give one message to people who are at risk out there, it's to realise that these safe limits that we talk about for alcohol are real, and alcohol drunk to excess is damaging your liver even if you're feeling fine. This is a silent illness until it's too late.